Of that prep work is going to require funding, and that's why today Governor Ralph Northam announced that he is using $22 million of Virginia's federal CARES Act funding to make sure Virginia is ready for this vaccine.
There's a lot of logistical pieces that we have to have in place.
The Virginia Department of Health says the $22 million will fund COVID-19 vaccine rollout preparation efforts through the end of the year.
Our equipment, ancillary supplies, some staffing, both in information technology, but also at the local health department level with vaccinators, clerical work.
How it will work is laid out in a draft plan that Director of Immunization Christy Gray says VDH has already submitted to the CDC for approval. She says they're expecting a response by next week. It includes several contingencies as there are still some unknowns, such as which vaccine will get approved and who will get it first.
Likely candidates would be healthcare workers, essential personnel, and long-term care facility residents.
In terms of when a vaccine could be ready, that's something that was brought up during Thursday night's presidential debate.
It will be by the end of the year, but I think it has a good chance. There are two companies, I think, within a matter of weeks.
There's no prospect that there's going to be a vaccine available for the majority of the American people before the middle of next year.
Gray says she can't speak to when this may start, but adds their plan was ready for a November 1st rollout.
We just didn't want to be ready.
Whenever it does start, Gray says she understands concerns people may have with the speed it was produced, but stresses safety protocols have not been skipped during vaccine development.
There are financial pieces that have been removed because you have the federal government paying for this rather than the manufacturer. We do want to make sure that Virginians know that our number one priority is their safety.
And again, that $22 million is going to get this program to the end of the year. VDH says they anticipate needing $120 million for the whole program, and they says they are working to find that funding for 2021.